Me?
Yes, we can. So we're delighted to be joined by Nestor Owomuhangi, who is the UNFPA representative for the occupied Palestinian territories. And you are joining us from Gaza, is that correct?
Correct.
Excellent. Well, Nestor, you have the floor, and then we'll take some questions. Thank you.
Thank you very much. I'm indeed here in Gaza to see conditions for maternal health and protection services on the ground, and to listen to health providers, social workers, women, and girls. In recent days, I've visited the patients-friendly hospital in Gaza City, Alauda Hospital in Nuseirat, Nasser Hospital and Halawa Temporary Health Care Center in Khan Yunis. I've met women and girls in safe spaces in Khan Yunis and Deir Bala, and a youth hub in Nuseirat, and visited displacement camps in Khan Yunis. I've heard from women, midwives, health workers, partners, and families who have endured more than anyone should ever be asked to endure. On my first morning here, a woman at a safe space in Deir Bala told me, the ceasefire is a breath, but one cannot live on a single breath. And her words capture Gaza today, a population holding its breath, suspended between survival and uncertainty. The sky is quieter, but the trauma remains loud. The ceasefire was desperately needed, but it is not an end to the war for women and girls, not physically, emotionally, or economically. Most families still live in overcrowded shelters where hunger and disease threaten daily. More than 57,000 households in Gaza are now headed by women. Many of them are deeply vulnerable with no income to support their children. And now winter rains and flooding are adding a new layer to suffering. In one displacement camp, a mother showed me where water pooled in her tent. She said, "This is where my baby sleeps. I held him all night so he would not be wet and cold." Please queue for hours for food and water, cook over open fires, wash in buckets, and sleep under damp blankets. People no longer ask for homes, education, or proper food. They ask for a tent, a small heater, or a light. Their expectations have collapsed as devastating as any destroyed building. Expectations have collapsed. People who once asked for homes and schooling now ask for a dry tent, a small heater, a light that will stay on. First, let me turn to the health sector. The health sector is shattered, and this has been reported over and over again. Only around, today as we speak, only around 1/3 of the health facilities are even partially functional, and all are understaffed, overwhelmed, and lack basic supplies. Medicines are scarce, neonatal units are overcrowded, and yet staff continue despite extreme personal loss. In a maternity ward, a doctor pointed to an incubator with 2 tiny premature babies and said, every complication is now magnified by the fear of losing power. If the power cuts again, I don't know what will happen. Gaza's health system is still standing only because its workers refuse to abandon it. One midwife told me, I lost my sister and my house, but other women need me. I can't stop. Meanwhile, she has not been paid in months. rebuild the maternal health sector, we need to rebuild and equip the health facilities that have been destroyed. We must ensure a steady and reliable flow of medicines and supplies. We also need to rebuild the health workforce, and we must restore referral pathways so women can once again move safely through the system and receive the life-saving care they need. Second, to gender-based violence services, which are severely strained. Gender-based violence is rising in Gaza, as it does in every humanitarian setting. Women describe living in fear of overcrowded shelters without privacy. Many stress the risk this poses to their daughters. We must rebuild and reopen safe spaces and shelters, reactivate GBV referral pathways, and restore integrated services across all governance. Women-led organizations need support to deliver quality, trauma-informed care, and gender-based violence providers must be strengthened alongside strong mechanisms to prevent sexual exploitation and abuse. And third, to the youth and young people, the trauma faced by Gaza's youth will shape this generation. Yet their determination struck me. I visited our youth hubs where young people learn new skills and tutor children. There, a teenager told me, we lost our classrooms, but we didn't lose our future. We need to build the skills of young people in leadership, digital innovation, green livelihoods, and entrepreneurship so that they can actively contribute to community recovery. We must strengthen youth organizations and community-based groups so they can design and lead locally owned recovery efforts. What has been UNFPA doing? Over the past 7 weeks of the ceasefire, UNFPA has reached over 120,000 women and girls and young people with reproductive health services, dignity items, and care for survivors of GBV. We are delivering medicines to hospitals, restoring health centers, opening safe spaces, and supporting mobile teams and frontline workers. Currently, UNFPA supports 22 health facilities, which is about 11% of the entire health system, which includes 5 hospitals. We are supporting 14 women and girls safe spaces, 2 shelters, and 9 youth hubs. In 2026, we plan to double this number. But even weeks after a ceasefire, access remains a problem, with only 3 crossings open, and never at the same time, as well as continued red tape imposed to bring in supplies. We are still seeing huge delays in deliveries. We need predictable, sustained, safe humanitarian access through all crossings to all parts of Gaza, especially the North Gaza. With this, recovery cannot gain momentum. Without this, recovery cannot gain momentum. The ceasefire is the beginning, but to build a real hope, we need action. And action requires access and resources to give women and their families the opportunity to begin to rebuild their shattered lives. As a mother in Khan Yunis told me yesterday, do not let us survive only to suffer again. Let this ceasefire mean something. And I thank you.
Thank you very much. We'll first go to Deji.
Hi, Nestor. This is Xu Deji with China Central Television on behalf of the UN Correspondent Association. Thank you for this briefing. I have a couple of questions. You just mentioned about the ceasefire and all the situation after that. Can I understand there's ceasefire, which means the gun has been silenced, but there's still a big problem of the excessive humanitarian operation? And secondly, during the ceasefire, we see some better change, I would say, of the situation, humanitarian situation in Gaza. But what's your assessment? How can the humanitarian situation be restored? How long will it take to do that? And thirdly, you also mentioned about the border crossings. Do you feel there's still intentional restraint, intentional limitation for humanitarian especially personnel, to get inside Gaza and help the all those midwives and people there? Thank you.
Go ahead, Nestor.
Indeed, guns are silent in some parts of Gaza Strip, not everywhere. They are silent mainly in less than half of Gaza Strip, but beyond what is referred to as the yellow line, guns are still blazing as we speak. The only challenge is that yellow line is imaginary. You can't clearly see where it stops, so people are still dying. But yes, since the signing of the ceasefire, we've seen tremendous improvement. There has been inflow of supplies. What we are concerned about is that it's not about the approval of these supplies into Gaza. It's getting into Gaza. We are talking about 3 access routes. 3 access routes basically mean a limited number of trucks. Now, it also means once you get the approval, the 3 routes that are available to us, we have to then again prioritize which trucks should be able to enter. Once they enter into Gaza, there is a whole long process of coordinating movement, because not every truck that enters Gaza continues into Gaza. So we have to again coordinate movement out of a platform that comes into Gaza. So that takes a long process. So from the approval, access through those 3 routes, and then coordination within Gaza takes a long time. So much as we've seen an improvement, much more needs to be done. And it's not everything that we require in Gaza that gets approved. And that's another challenge. You talked about the border crossing, and I think that answers it. It's not only personnel. We would wish as humanitarians to determine what is actually essential that we need. Both the humanitarians indeed, as mentioned, but also the type of supplies that we require. Not everything that we require comes in. What is approved, it may not be exactly what we need, and that's where we have a big challenge.
Thank you very much. We'll go to Ibtisam Azam online. Ibtisam?
Thank you. Hi, my name is Ibtisam Azam, Al Arab Al Jadid newspaper. I have a couple of questions. First, a follow-up on what you said regarding what you are not able to bring in. If you could give us some examples. And do you have also an issue with visas, like for international, for your international workers to get into Gaza? And if you could also talk about the psychosocial support and the needs and what you are seeing there. Thank you.
Thank you. Go ahead, Nestor.
So we have 2 types of approvals. We need visas for staff to be based in Jerusalem and coordinate the response. So those visas are usually very difficult to obtain. We don't need visas into Gaza, but we need clearances for staff to get into Gaza. Not every staff gets cleared. Even those who are cleared don't get a chance to return. So yes, there is a stringent visa regime or clearance regime for staff to enter into Gaza, and that certainly limits our capacity to deliver. In terms of psychosocial support, within our own, I can give you an example of the magnitude of the problem. We've recorded over a period of time almost 100 suicide attempts by gender-based violence survivors. Now, these are gender-based violence survivors, a tip of the iceberg. So we have reports from everywhere about the increase in mental health issues. And this is emerging as a very, very big problem, not only among women, but also among young people.
And just about the part of, you said that not everything that you want to bring in get approved.
Right.
So if you could elaborate on what doesn't get approved, what do you need that you are not able to get in, or thank you.
So as a UNFPA, we are a population agency, sexual and reproductive health agency. We would wish to deliver a wide range of reproductive health services, including safe deliveries. Now, for us to deliver safe deliveries, we need equipment, devices, and supplies. So some of the supplies get approved, some of the devices that are crucial, ultrasound, I give you an example, are so-called dual-use items. And I can't define to you what dual use is because we don't have a global definition and we don't even have a local definition. So some of the items ranging from even scissors could be denied entry because they are considered dual use. So we have a number of these items that are so crucial for delivery care that can't come in. And if you don't have a full set of equipment, then your service is certainly not complete. So unfortunately, I can't list everything because it depends on what is defined by the authorities. And we are told now this is now considered dual use, don't bring it in. It's a whole range of items, and some of these are very crucial.
Thank you. Any more questions in the room online? Nestor, thank you so much for joining us. We really appreciate it, and we're very honored to have you with us. And please give our best to all your team in Gaza who are doing such amazing work.
Stefan, thank you.
Take care. Thank you.